Hello, today Emily and I will be discussing the topic of traumatic brain injuries. A traumatic brain injury is caused by an external force that temporarily or permanently disrupts normal brain function. According to the Individuals with Disabilities Education Act, a traumatic brain injury refers to open or closed head injuries resulting in impairments in one or more areas, such as cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical functions, information processing, and speech. When teaching students with disabilities, there are many interventions and accommodations to help students suffering from a traumatic brain injury. It is important for teachers to be aware of the educational challenges that students with TBI face. These challenges include difficulty taking tests, problems following directions, and difficulty learning new skills. Students with TBI often experience speech, vision, hearing, and other sensory impairments. It is important for teachers to watch for these signs and others like decreased coordination, headaches, loss of intellectual capacity, partial to full paralysis, and speech problems. Students with TBI also face cognitive problems. They often lack organizational skills, lose focus easily, and have poor judgment and memory skills. As far as behavior, students with TBI can express aggressive behavior, experience depression, lack emotions, and can have outbursts of inappropriate crying or laughing. Students with TBI often have difficulty maintaining relationships and have inappropriate response to their surrounding environment. It is important to remember that these problems mentioned can all range from mild to severe. Every individual with TBI is different, and their course to recovery can vary from one individual to the next. There is a lack of awareness about the consequences of students who experience TBI. Often children can be wrongly classified as having learning, emotional, or mental disabilities, resulting in the wrong kind of educational supports and services. This is why it is important for TBI to be classified as a separate disability category. It is first important to develop a plan for students who are re-entering school so that their needs can be met in the most appropriate way. Here are some tips and strategies for teachers teaching students with TBI. To help students with TBI, teachers can extend time to complete assignments and tests. Teachers can also give students with TBI test material early to give them the opportunity to go over information before class. Formula sheets, customized test formats, and allowing students with TBI to answer questions orally can help them succeed on tests and assignments. Taking notes can also be a big challenge for students with TBI. Giving students copies or audio recordings of notes for that day's lecture gives students with TBI the chance to listen to the material as many times as they need. This way, they can take in and absorb the information in chunks rather than all at once.
Students with TBI can become easily overwhelmed or stressed. It is important to allow students with TBI to have opportunities throughout the day to calm down and relieve themselves of a difficult situation. Letting them go for a walk or leave the room is a good way to help a student with TBI regain control of their feelings. Arguably, the most challenging aspect of TBI is behavioral problems. Students with TBI can become frustrated or depressed. It is important for teachers to be extra supportive, patient, and understanding. Becoming an advocate for students with TBI can help them feel secure and confident in their ability to overcome any challenges they may face. Assistive technology can support the multiple levels of TBI. Such technology can especially help students who struggle with memory and organization. The use of schedules, reminders, voice organizers, smartphones, and watches are some tools to help students who face these challenges. Students with TBI may also need help accessing materials for school. Specific software for different needs can help these students. Speech recognition, screen reading software, tinted screens for visual problems, and other academic software packages are just a few examples of helpful technology. As previously mentioned, TBI can cause students to have partial or full paralysis. Guaranteed access to canes, crutches, wheelchairs, specialized beds, chairs, desks, and tables can give students with TBI the ability to actively and comfortably participate in class. There are many supportive teaching methods and strategies that can effectively help students with TBI. Along with these strategies, it is recommended that an IEP is developed and frequently revised and reviewed. Although TBI can vary, these strategies can reduce or even prevent learning difficulties and behaviors that challenge students with TBI. Here are some helpful teaching strategies. Clearly state tasks and directions and provide examples to help students understand the importance of acquiring learned skills. It is also helpful to ask the student to repeat the directions to ensure they have fully understood. It is important to not give too many steps all at once. Tasks should be broken into small steps and first demonstrated. Pacing can become a challenge. Providing students with TBI the opportunity to respond and practice tasks at an appropriate pace can help relieve any frustration they may have from feeling rushed. It is also important that through every step of learning, feedback and corrections are given when necessary. This will help the learning process function smoother and also help the student feel more supported. Lastly, verbal praise and encouragement is so important. Support is the biggest motivator for all students to achieve meaningful educational goals. Successful and positive supports for students with TBI should always include interventions designed for that specific student. Using positive reinforcements are valuable to create a successful and rewarding environment for students with TBI. Students with TBI may face challenges when returning back to school after their injury. Although every student's experience can differ and behaviors and cognitive difficulties vary, success is still possible. The use of IEPs, classroom accommodations, teaching strategies, and knowledge about TBI can help educators assist students with TBI overcome the greatest of challenges during their academic experience. Thanks for watching.